Thank you. Well, good morning and welcome everyone. Jim Brett of the New England Council. I hope that everyone continues to be safe and healthy during these challenging times we are living through. We're thrilled so many of you could join us today for what is, believe it or not, our 6th installment on the Council's Leading in a Crisis virtual event series. We first launched this back in May, and over the course of the last several months, we've heard from leaders across a wide array of industries, healthcare, to energy, to banking, to higher education. We have learned how they have adapted and innovated in response to this global health crisis. In just a couple of weeks, on September 3rd, we'll be hearing from leaders in the travel industry about how they're working to keep travelers safe and healthy during our 7th Leading in a Crisis program. But today, we're talking about a topic that I know is of great concern to many of our members, not just in your professional capacities, but because so many of you are parents. And August is usually an exciting time of the year for families, filled with back to school shopping, preparing to meet new teachers, and excitement about being reunited with friends after the summer vacation. Well, this year, it's a time of great anxiety for parents, educators, and students alike. And there are so many pressing questions on our minds. What will the school year look like amid this pandemic? Will students be in a classroom or at home learning virtually, or both? And what does it all mean for both their physical and mental health and their learning and development? Well, the good news is we have some incredible expertise right here in New England, and we're honored to be joined by 4 leaders who have been hard at work to find a way to strike a balance between keeping everyone healthy and preventing the spread of the virus, while also ensuring that our children get the best possible education. Joining me for today's discussion are Sandy Fenwick, the CEO of Boston's Children's Hospital, which was recently named the nation's top pediatric hospital by U.S. News and World Report for the 7th year in a row. What an accomplishment. And we are blessed to have that hospital here in Boston. Sandy first joined Children's in 1999 and has served as CEO since 2013. Under her leadership, the hospital continues to grow and make incredible life-saving medical breakthroughs to improve children's health and transform lives. In recent months, Children's has not only been a national leader in research about how the virus affects children, but it's also provided guidance to parents, schools, and child care providers on how to keep kids safe and healthy. Dr. Robert Franks is the President and Chief Executive Officer of Judge Baker's Children's Center and a faculty member of Harvard Medical School. Dr. Franks works at the policy, the systems, and practice levels to create sustainable change, improve access to quality behavioral health care, leading to lifelong positive outcomes for children and families in Massachusetts and beyond. And under his leadership, Judge Baker Children's Center is a national leader in children's mental health, and in recent months, the center has provided resources and support to families as they grapple with the anxiety that these uncertain times have caused for many children. Michael O'Neill, longtime member of the Boston School Committee, and previously served as the chair of the committee from 2013 to 2017. During his term as the chair, he oversaw the strategic planning process for the school committee, the search and the hiring process for a new school superintendent, and the development of the Opportunity and Achievement Gap Task Force. In addition to his role in the Boston School Committee, Michael serves as the chair of the board of the Council of Great City Schools, which is the main governing body of the coalition of the nation's 76 big city school districts. In this capacity, Michael has been working with school districts throughout New England and across the country as they prepare for the new school year. And some of you may know Michael from his day job, where he serves as Executive Vice President, Boston Marketing firm Zosimus, which is located right next door to us in North Washington Street here in Boston. Shelley Pasnick, Vice President, Director of the Center for Children and Technology at the Education Development Center, or as we've referred to, EDC. Shelley is a nationally recognized expert in the thoughtful integration of digital media into education, a topic that has become all the more critical among the pandemic. She oversees EDC's global early childhood initiatives and guides the production of children's educational services in collaboration with partners, including the United States Department of Education, PBS, MIT Media Lab, Google, and IBM, just to name a few. I want to thank all four of these panelists for taking the time to join us and share their expertise today. So let's dive into the discussion. First question, Sandy, let's begin with you. To set the stage for our conversation today, can you begin by discussing the work that Boston Children's Hospital is doing surrounding the COVID-19 pandemic and its impact on children?
Well, thank you, Jim, and thank you all for the opportunity to share all of our various perspectives on this topic. So where we're at Boston Children's entering our 8th month of this pandemic, since in January we began to prepare because we saw what was potentially coming, and set up our own command center with safety, safety, safety as our North Star. We had to prepare the hospital for everything from infection control to everything related to caring for the safety and security of our own people, our staff, our faculty, but also our patients and families. And so we largely had to take down a lot of what we were doing to prepare not only for the potential influx of children with COVID-19, but also to help the other adult systems, not only in Boston, but across the state and across New England, if they became overwhelmed with adult patients, which many of them did. And so we became sort of the destination for, we called it a pediatric coordinating center. And that happened during the months of early March, April, and almost into May, until we kind of got over that surge across Massachusetts and New England. That was something that was incredibly important for us because it really built on our expertise of caring for children while helping the adults with their own capacity. We sent staff to them, we sent ventilators to our adult colleagues when we didn't need them. And so we tried to find a way that as a pediatric provider, we could support the rest of the system. We also led global calls. One of our key leaders started a call and ended up with 2,000 and still going participants, now once a week, although they were meeting very often, with the WHO, the CDC, NIH, government leaders across both countries and states to really try and understand what was happening. How do you treat this? What are these new syndromes that we're seeing? And so we've been very helpful in trying to pull that data together. On the research side, we were talking earlier, one of our key leaders here at the hospital, Dr. Adrienne Randolph, is now leading the largest study of children with COVID-19. This is sponsored by the CDC and involves 28 other children's hospitals across the country, really gathering data of children who've been exposed, children who've been positive, so that we can really begin to understand why are certain children not as vulnerable? Why are certain children more vulnerable? Why are children ending up in the ICU? Why are children getting this new multi-system inflammatory syndrome and ending up with very, very severe disease and in the ICU? We're trying to understand those categories of children and understand the underlying biology, immunology, infectious disease impact of all of these things that are impacting children, and what the implications are for their transmissibility, and for their long-term health and well-being. We've got a wonderful doctor here who very early on in precision vaccines started to pivot away from specifically certain populations and to even the elderly who are more vulnerable. So we've been working hard on both the clinical and the research. And as Jim said, also in trying to use our expertise to help guide schools, the state, early child care, early education, and of course, secondary education. So Jim, we've been trying to prepare to respond, to really understand, inform, and lead where we can.
Great. Dr. Frank, some of the participants in today's call may not be familiar with the Judge Baker Children's Center. Can you give us some quick background on it and how the operation has changed since the pandemic has hit?
Absolutely. We're a multi-service children's mental health and special education provider in Greater Boston. We're actually over 100 years old. So one of the first questions people ask is, why Judge Baker? He was the first juvenile court judge in Boston, actually the second in the nation. And we were named in his honor and been providing services to children of Boston ever since. Through our center, we provide direct outpatient services to children and families. We have a special education school for kids with an out-of-district placement that have significant behavioral health needs. And then we have a variety of specialty programs. We also run the state's child abuse and neglect emergency line after hours. And we also provide training and consultation, both here in Massachusetts and around the country, in our evidence-based practice models that help children. So really a range of services and supports that we provide. Like every other provider in Massachusetts, we've had to really think about how to continue providing the services that we do, how to meet the needs of our families. There have been multiple challenges in that regard. You can imagine that if you are a family that has a child that has behavioral health challenges or special education needs, imagine how difficult it's been for all of us with children during these times. And then to add to that, the needs of a child that has these types of challenges. Oftentimes when kids are in school, when they're seeing their pediatric providers regularly, when they're in their early care and education settings, they have a safety net around them of support. And in many cases, the families that we're seeing now have really had that ripped away and are trying to cope as best they can. We've adapted to that by providing telehealth services. We forged forward with that before even sometimes some of the insurance providers caught up in terms of reimbursing those services. We feel that in some cases it's worked really well. It's improved access to care. Our demand is higher than ever. It's really incredible, the demand that we're seeing. Many families who had never experienced mental health challenges before for themselves or their children are feeling it the first time. I think probably all of us can relate to that, given the stress that many of us have been under. So we've really tried to work hard to do what we can to improve access to those services while recognizing that it doesn't work for everyone. And that's probably the families that we're most concerned about. One last thing I'll mention is that our special education school, the Manville School, we actually had 2 weeks in-person session this summer under the guidance of the Department of Elementary and Secondary Education. It was sort of a test for us to see how that worked. And we had a smaller student population. Many of our students were still attending remotely. And we learned a lot from that experience in terms of what worked and what didn't. We made very significant preparations, but I think one of the biggest take homes was until you're in it, there are things that you may not fully anticipate, and you really need to be flexible and adaptive to meet the needs not only of the families you're serving, but also to support your staff.
Great. And then Shelley, the other vice president of the EDC, the global nonprofit that advances lasting solutions to improve education, promote health, and expand economic opportunity. Can you discuss the work your organization does and how that may have shifted amid the pandemic?
Yes, thanks, Jim. There isn't anything that we're doing prior to this pandemic that hasn't been upended. I think as the others are describing, right, there's so much just radical change that has happened as a result of this new environment that we're living. Described in the beginning, much of the work that we do has us in partnership with media organizations. So we were in the midst of conducting a study with PBS and a new program from WGBH, Molly of Denali, which really centers Indigenous families and communities. And we were in the field with that study and needed to decide whether we proceeded with it and then how we moved to entirely remote data collection, as an example. Likewise, really thinking about the work that we do beyond the New England environment. We are headquartered in Waltham, and though much of the work that we do has global considerations, so for several decades we've had a tradition of creating interactive audio. Who would have thought that radio would be this powerful medium? And yet it really is. It can be just a dynamite way to reach young people and families and communities in resource lean settings. And we've been doing that work and continue to do that work with the World Bank. Likewise, thinking about suicide prevention, that's a strand of work that we've been doing for many years. So taking the media perception and the perception that we often hear from news outlets that suicide rates are going to increase, and how do we convert that so that that's not an accepted inevitability, but really to provide the supports. Likewise, thinking about social emotional learning and how we are working with school districts and other educators who are contending with social isolation and bringing health supports, no longer thinking in a siloed fashion of education and health, but really the blending of the two. And I know probably, 151 other people who are joining this session at current count are, I'm sure, thinking along those blended approaches as well. So those are just a couple of ways that we needed to make that pivot to go from what we know to asking new and different questions, so we really meet this moment in a different way.
Right. And then Michael is the chairman of the board of the council of the Great City Schools, as well as a member of the Boston School Committee. Can you discuss what the approach has been over the last few weeks as we begin to prepare to reopening the schools?
Sure, Jim, thank you. And first of all, thank you for the invitation today. And I'm honored to be with Sandy and Shelley and Dr. Franks as well for this valuable conversation. And I do deeply appreciate the work the New England Council has done to pivot and adjust and continue to add value to its members by convening conversations such as this. As Sandy just said, Children's is convening conversations at the Council of Great City Schools. The planning among our member districts, which, as you said, is the top 76 urban districts in the country, actually started back in about April and May for this year, when we had a pretty good sense that there was a good chance we were going to be remote or at a minimum hybrid for this year, or that we had to have a range of options. We also knew parents were very patient in the spring, but their expectations were going to be considerably heightened in the fall if we were going to be remote. They wanted a better educational experience for their children. So at the Council of Great City Schools, we started convening. We have about 12 weekly calls going on for everything from chief financial officers to academic officers to superintendents to school board members. And we put together white papers and best practice guidance for our member districts, which in New England include not only Boston, but also Providence, Hartford, Bridgeport, and Manchester, New Hampshire are members of the organization as well. So the council's been working for quite a while. And then within Massachusetts, once DESE gave guidance at the beginning of July to districts, and they were really saying specifically to us, they want our children in school if at all possible. And so the Mass Association of School Committees and the Mass Association of School Superintendents have been working together and convening calls for us that we've been joined, for example, by Commissioner Riley. And he made it clear about, for the learning curve for our youth, for the ones who are falling behind, for the emotional health of our students, it's so important for us to get them back in school if at all possible. not to mention what that is for parents trying to get back to work, et cetera, that we cannot afford how far our students are going to fall behind because of this. So he asked us to try to get our students back in if at all possible. But DESE formally, DESE being the Department of Elementary and Secondary Education, formally asked every district in Massachusetts to come up with 3 plans and present them by the end of July. One was, what would it look like if we were in school fully, and what protections would we have for staff and for students, social distancing, et cetera. What a hybrid model would look like if some students were in some of the times. Would we simply put students in A, B, you know, some are in some days, some are in other days, or would we, like some districts are doing, focus on most emotionally and physically fragile children up front, or our younger ones? And then lastly, what a remote plan would look like. And then we were asked to say what we wanted to do. In Boston, we have asked, first of all, for a 10-day delay in the start of schools till September 21st, which the commissioner had arranged for us to ask for. We have also indicated that we are going to make it parent choice about whether they want to be remote or whether they want to be hybrid. And within hybrid, they can either choose to be in for 2 days and out for 2 days, and the middle day is for cleaning and professional development. Or for our most fragile students, particularly our students with disabilities on IEPs, et cetera, they could be in for 4 days during the week. We have now put that out to our parents just recently, and we are waiting for responses of how folks, whether they want to be fully remote or whether they want to be in a hybrid model. I will say, nationally, 59 of the 76 districts that are in the Council of Great City Schools have decided to go fully remote. And so we are seeing this in many other parts of the country, particularly those that are really the hotspots right now. In New England, all 5 of the council members that I mentioned, Boston, Providence, Hartford, Bridgeport, and Manchester, are either in person or hybrid, but giving a remote option to the parents because we're seeing lower incidence right now in New England. But we're learning from our fellow districts that did open, particularly, you know, many parts of the country start earlier than we do. And so we're already starting to see some changes happen. And unfortunately, we do expect that this is going to be a year of back and forth, that no matter what we start with, we have to anticipate that plans are going to change.
Great. We have a few questions here from some of our members of the New England Council. And Sandy, this one is for you. There's been a lot of discussion lately on how COVID-19 affects and can be spread by children. Like so many aspects of this virus, there's been a constantly evolving understanding on how the virus spreads and impacts different populations. Curious to hear what you have seen in your role at Boston Children's Hospital and what parents, students, and faculty should prepare for this fall.
So, Jim, you know, I think the jury is still out on a lot of these questions. And I think that's really one of the things that I think all of our leaders in the field are continuing to stay. As you saw today, there was an article, a paper from MGH. There have been papers from South Korea that have talked about what are the different age groups and how are they either viewed as carriers? Are they viewed as transmitters? Will they be symptom-free or have symptoms? Will they be positive or negative and the like? And I think all of those questions are still somewhat up in the air. We've seen an increase last week. The CDC put forward the fact that in the rest of the country, we're starting to see children between the age of 0 and 17 increasing with positivity. And the question there is it because of some of the schools that are going back? Is it because we're going back to more density? And is density the question that's really been driving some of this increase? Clearly, we need more data and we need more testing to understand this. Kids have had lower infection rates for certain, far lower than adults, at least over the last 6 months of this pandemic. They also seem to be less sick than what we have experienced with adults. So their hospitalization rate is about 8 per 100,000, where it's about 165 per 100,000 for adults. But when they do get sick, they get very sick. And their rate of being in the ICU is about the same. So we're starting to get data that actually gives us some insight into children and what's happening with them from an infection perspective and infection transmission perspective. But again, we still don't know. We do believe that the most important thing that people need to do, whatever we do, is to think about all of those safety measures. Wearing masks, maintaining the least amount of density and therefore social distancing, hand hygiene, environmental cleaning and disinfecting, and then checking symptoms. Now they're saying we're not sure that there's even a temperature connection to children. So the data just keeps changing over and over again. To Michael's point about flexibility, I think we have to be vigilant. We have to watch the data. I think we have to be very clear on watching and understanding what the science is telling us, and sometimes it's even contradictory. But I think it's going to influence, Michael, your point about being flexible is sadly where we have to go. I think there's no question we will all want to reopen as much as possible. These children do need their social, developmental, educational well-being by being in schools in some form. But I do think we need absolute safety measures, risk reduction efforts, vigilance around that, and then some flexibility.
Shelley, I have a question. Go ahead. Michael,
Jim, may I ask Sandy a quick follow-up about that? Because I think it's very critical to our teachers and staff in particular who are going to be working with students. And quite frankly, they're very nervous about, the Globe this morning talked about Mass General having a study where children can be asymptomatic but still have the virus with them. And so some thoughts on research on that can help guide our thought process for teachers who are like me, that are considered in high-risk categories and are very nervous about being back as we think about particularly our younger students versus our high school students, et cetera. Any thoughts on that, Sandy?
Yeah, sure. So the study that came out this morning from MGH actually was similar to the study that came out of South Korea, with a very much larger study that actually showed that the children below the age of 11 or 10 are really less likely to be positive and to have high loads of virus. That was true in South Korea in a very large, I think it's 60,000 students and families that were all monitored. As you get up into the over, say, age 11, both this study, but also the one in South Korea, showed that more of the children are looking more like the adults. So, when you talk about kids, I think we need to think about that whole spectrum. What's happening with childcare in the very, very early kids, what's happening with elementary age school kids up through, say, 11 or so, and then what's happening with the middle school and high school kids and above. And so I think those are the questions we still have. We need a lot more. It was a small study. So I think this is exactly what this study that Dr. Randolph is leading much, much more broadly across the country, trying to really get at a level deeper of how much is this really the case, and what do we do about these age segmented children?
We have a question here for you, Shelley. You recently co-authored a piece which focused on integrating technology into early learning. Can you discuss some of your findings and what role technology may play in reopening our schools this fall? And can you speak to the challenges that some students may face when it comes to an internet and technology gap?
Yeah, so nationally, 17 million children do not have reliable access to the internet or technology, right? So I think to be mindful of a pandemic happening at a time of growing awareness of racial inequity and the social determinants of health is extremely important. And we see that playing out with respect to the technology infrastructure. What we find, though, is that with any sort of technology consideration, it's important to first think about what the assets in a school are. And there are, four general areas that we often think about is, first, what is the culture of collaboration among teachers? That I think some of this is coming up. I leave the science to, my health colleagues to really talk about, what's the evidentiary base on which we will make decisions. There's also the perception or how people feel about their sense of safety and how teachers might be feeling a sense of collegiality with one another and seeing one another as allies and as supports. So that's, one piece. Another is focusing on the relationships. There's young people needing to have a sense of themselves. Many of the teachers will talk about they first need to attend to self-regulation and executive function. Are children able to show up ready to learn? What levels of trauma have they experienced? Do they have a sense of agency in this environment? We know that, some young kids are really taking to a virtual experience. Others, it was a complete turnoff. So really thinking about the affordances of the technology and what can do. Likewise, thinking about, emergent language learners. So what does it mean to be whether in a classroom or to be on a screen as we all are today with a mask covering your face and you can't see one another forming words, and how does that contribute to oral language development? It may feel like I'm going far afield from technology, but we often think that it's important to remember that learning is human intensive. And so how do we get the infrastructure in place, the human infrastructure in place, and then think about whether it's Google Classroom or Seesaw or GoNoodle or there are any number of lists of software programs. But if we haven't put in place that structure, so we're thinking about what, how are we meeting young people so that they have a readiness to really take up this challenge of being in a classroom, being out of a classroom, the exposure in their homes. Right now, they might be joining, and we're seeing this in some of the early openings of, when kids feel confident to turn on their microphone, to turn on their video. And how do you do that at the beginning of a school year? There isn't a sense of community, and when kids have had many months, as I said earlier, about social isolation. So those are all, different considerations, but, regarding the tools that you also mentioned, Jim, those are available on the website if you want to see. We also, create free resources, rather than, pushing out lists of websites or tools. We try to give parents and teachers a framework, so they can make sense and think, okay, I can construct this, because so much of what we're doing is reconstructing and reimagining what teaching and learning is, in August of 2020, which may not be, what they've known during their tenure.
On a similar note,
may I pick up on
yeah, go ahead.
something that Shelley just mentioned? One of the things that I think Shelley really hit the nail on the head for some of the issues that we see, but one of the biggest things that I've been advocating for many years is the importance of mental health services and supports in schools. And we work with a lot of school districts around those issues. Now those services and supports are more important than ever. And if you talk to, our colleagues in the Boston Public Schools, they'll tell you how, in many cases, many of our schools are under-resourced in that regard in terms of school psychologists and school social workers. So you're pointing to, this need for us to be able to identify and refer children for appropriate services and supports. But we really have to also think about our capacity issues, and do we have, the appropriate capacity in schools to support our classroom teachers, to support parents, to identify students and get them the help they need.
I was going to ask a similar note to you, Dr. Franks. I know that Judge Baker Children's Center does a lot of work with students who have learning disability. Can you just speak to the challenges that these students will face now in a presumably disrupted learning environment?
Well, I think most of us know that one of the most important things for all children, and especially for children who may have special education or behavioral health challenges, is consistency and predictability. As Shelley had mentioned, having those self-regulatory capacities are important And for children that don't, they rely on their environment to provide those regulatory capacities and supports. So this is very challenging in many cases for families where there's going to be this very new and different and disrupted environment. One of the biggest predictors that we see of how well kids do, for example, that have been exposed to trauma, an area that I worked in for many years, is we sometimes look at their supports that are around them. We look at their families, we look at their family's ability to mediate the experience. And many of us who have children are compromised ourselves. We've been stressed and frustrated. So the question is, how do we mediate this experience for children? How are we clear to them in our communication about what's happening? Many times we don't even know what's happening. So imagine for a second the child's experience of not knowing, will I go back to school? Won't I? What do you mean I'm only going to be in school 2 days a week? I'm going to be home the other days. What do I do the other days? Who's going to help me? Who's going to watch me? All those questions. Thinking about a parent trying to juggle their work schedule for those 2 days when the child is home in a hybrid model, or if they've made the decision to educate their children remotely. So I think the challenges really focus on, in some cases, the capacity of adults to be able to provide the supports that we need to children, to be able to clearly explain to them and so they can have some expectation, to provide them with the scaffolding they need for this experience. And then once they're in that school setting, to make sure that, we're doing a good job of at least making it look like we know what we're doing, so that the child can actually have a sense of safety and security in that school environment, so that they could feel like the adults have a plan, that the adults are providing that holding environment for them. And even though there's some uncertainty, they know that they are being taken care of, that we're doing our best to provide them, with a safe, supportive environment. And I think those are some of the biggest challenges we face. Also relating to some of the technological issues, obviously, imagine a child who needs speech and language therapy, how difficult that might be accomplishing that in a hybrid or remote model. Children who receive multiple services under an individual educational plan, occupational therapy, they might receive individual counseling and support, reading specialists, thinking about how to pack that into a couple of days a week or augment that remotely. These are all going to be challenges that kids face. And then the last thing I'll mention is that for kids who are might be coming in more days a week, we heard Michael mention earlier that special education kids might be coming in 4 days a week, which is one of the things that we face. For the staff, that's also a challenge, because sometimes children with special education needs or behavioral health problems might be more difficult to manage in that environment. So getting them to follow protocols, getting them to wear their masks, children who might become physical or have, be challenging with other students or with their teachers. When you add COVID to that, there's a whole other layer of complexity.
Question for you, Michael, and it's really a lead in to what just Dr. Franks talked about. Is one of the biggest challenges for employers during this time is the shortage of PPE for essential workers. As we prepare to open the doors to classrooms across the city, across the state, across the country, can you speak to the challenges that schools will face when it comes to not only providing the PPEs, but for students and teachers, but also discuss the budgetary challenges that those schools will face this fall?
Thanks, Jim. So yes, thank you, Dr. Franks, for what you brought up. And I do just want to close out your thought as I get to Jim's question, because they are tied together. We hear exactly the point you've been raising, which is why the past couple of years we have been stepping up the investment in school psychologists and social workers and guidance counselors and school nurses. Matter of fact, this year was going to be the first year we had a school nurse in every building, because we look at that team together as the ones devoted to our students' social and emotional health and their well-being. And in fact, studies are showing that anywhere between 30 and 40% of students right now are suffering cognitive and emotional health issues, and it varies by race. And so what we do remotely, matter of fact, it's a great model with Children's Hospital and UMass Boston, where we work together, called the Comprehensive Behavioral Health Model, that is doing school psychology work and helping our school psychologists deal with our students. And thank you, Children's, for that effort, which has become a national model. But even that has switched to remote. Matter of fact, they have a remote Zoom call going on right now 10 to 11 this morning for folks focused on the East Boston neighborhood. So we hear that issue and we understand the concerns. Jim, with regards to PPE, you know, we have so much work going on. We've been cleaning 125 buildings. We have 125 foggers coming in. We've done water coolers. We're repairing 2,200 restrooms. We're cleaning the HVAC systems in the 30 buildings that have it. We've opened and figured out how to fix several thousand, 7,000 windows across our 125 buildings, particularly those that don't have air conditioning systems, because we do have old buildings in Boston. We have in 157,000 reusable masks for our students, and we're getting another 70,000 donated by the Boston Red Sox, so thank you for that. We have another 135,000 disposable masks in stock, and 5,000 pieces of plexiglass. We got 64,000 pieces of signage coming in. So a tremendous amount of work is being done in our buildings, in our classrooms. But it will come down to, as Sandy said and others, wearing masks, social distancing, and Dr. Franks is absolutely right, particularly with our students with disabilities. You go in the car to school in Boston, which is where our most physically fragile students are. We have about 25 students there. And these are folks who are hands-on with their students, lifting them up out of wheelchairs, to use restrooms, or students that get emotionally upset. Trying to figure out protocols for that for our teachers that are in inclusive classrooms, which is we're trying to have more and more in Boston, is a challenge, and something that we're paying a lot of attention to, and quite frankly need the teachers' help in developing what are the right protocols that actually make sense. It's one thing to do it theoretically, it's another thing to actually implement. At a school committee meeting last night that went for about 5 hours, I had my mask on for 3 hours. Now I was on Zoom, I was by myself, but I was doing it to see, could I talk? Could other folks hear me through Zoom? Because we're gonna be asking teachers to stand in the classroom and teach students and wear a mask, but also be by Zoom. So I had to see, you learn by doing, and I had to see myself, was this realistic?
Sandy, I'd be interested in your thoughts, even though we're still in the midst of this crisis, and we're not at the point where we can look back and assess, but what would you say has been the top lessons learned so far?
Oh, there have been, many of them. I would say one of the things we keep saying at Boston Children's is that this is really, truly an ultra marathon. Until we get an effective virus and we get everyone to have the vaccine, effective vaccine, and until we get everyone to get it, we are going to be in this situation. And so we need to stick together at every level, learn from each other, be flexible, and stay with it, not letting up on our safe and cautious and compliant means and ways that we have to get through this. I think the New England states have done an incredible job when you look at the rest of the country, and I think the question is, how do we preserve and stay with that? And so, we've done it reasonably well. Maybe we could have done it better, but clearly we've got to stay with this at this reasonably low level. And so I want to do a hats off to all of our leaders in the New England states and to everyone who has really been supporting that. I think telehealth has been something that we have learned that we can do, and believe it or not, we have done over 100,000 virtual visits in the last several months. When you think about the people who have not been exposed to each other or to the virus as a result of that, it probably is 500,000, right? When you think about kids coming in with their sometimes multiple children, multiple parents or caregivers, the physician and nurses. So you think about, that has been not only a way to continue care, and especially with mental and behavioral health, it's a way of extending a very short number, shortage of providers in that area. So I think telehealth and the help that we've gotten from regulators and legal and payers, I hope we can continue, because I think there's still something very valuable about continuing that. One of the things that I just want to make a plug for, and that is we must make sure that people continue to get care for themselves, and maintain and monitor their own chronic illnesses, and especially for their children, to continue to get well child care, to continue to get all their vaccines. And most importantly, and I will say this every time you get me on until this is over, let's get our flu vaccines, because we cannot afford a twindemic or whatever we want to call it. That is something that will also be incredibly difficult for all of us, for business, for our healthcare workers, and of course for our citizens and people and children to live through. And so, I think there have been some silver linings in some respects. The partnerships that have formed, the support that people have had cross aisles in trying to figure out what to do and how to learn from each other, I think have been some great learnings. And if I could just do one plug, because Michael, you mentioned the work that we're doing with the work with our Children's Hospital Neighborhood Partnership. I'm hoping that one is also going to be recorded. And if it is, some of the sessions that we're doing, make it available to all of New England, because I think we're doing some wonderful things locally. The question is, how do we support all of our colleagues across the rest of the states? And toward that end, tonight, and Jim, I'll get this to you, we are doing a school nurse and COVID-19 set of 4 sessions, starting tonight at 4:30, and it's free of charge. It's a webinar, and there will be a panel of experts that are not just from Boston Children's, but are really across the whole continuum, really talking about how to support school nurses as they go back. And this will be available to anyone across New England. And we've also done 2 webinars for early education and childcare with our commissioner, and both of those have been recorded. And there's wonderful effort and expertise that could also be made available. So after this, I'll get you all of those linkages, and we can make it broadly available to anyone.
Great. And for the other panelists, as our region slowly emerges from stay-at-home orders and we begin to get back to some sense of normalcy, what are the top 2 or 3 things that you would advise students, parents, and educators to consider? Dr. Franks?
I would say that one of the most important things is this idea of how we're taking care of ourselves through this time. I've been completely overwhelmed and humbled by my own staff and their willingness to step up and be flexible and work long hours from their studio apartments, trying to, provide telehealth, to families in need. And I've been trying to focus a lot on their self-care. And I think that's important for all of us to do, particularly, thinking about our teachers, thinking about our school nurses, thinking about our school support staff. It's going to be incredibly important that we support these folks who are going into an unknown, and really, in many cases, incredibly committed individuals who are really caring about, the well-being of our children. And then the last thing that I'll say is really that emphasis on trying to remember the experience of the child. I think so often for those of us that are in decision-making positions, we come up with lots of plans and ideas and we're trying to do what's best, but we don't really think about what is the experience of the child in this? How are they being communicated to? How do they understand what's going on? There's actually a nice resource that was done in partnership with the American Psychological Association about how to talk to your kids about the COVID virus. I could certainly make that link available. We need to think about how we're communicating with our children. How do we help them feel safe and supported through this time? And how do we try and mediate this experience for them so that there aren't long-lasting repercussions for them moving into the future?
Shelley?
Yeah, I thought that was really well said. So I think we've done a lot of educational work to not take a deficit model. And I think the worry is that this pandemic and the challenges that we face will have us slipping back into old habits. And I would discourage us from doing that, instead to go towards resources, and in particular human resources. As a corollary to what Sandy was describing with telemedicine, I've heard from principals that participation in parent-teacher conferences has really increased as a result of the flexibility that schools are offering and being able to meet parents, not ideally in a video format, but that allows for a different kind of exchange. And so how to take that as an opportunity and build on it. Likewise, I've heard from from principals and other school administrators, how they reconfigured the roles of other administrators and office staff. So they were the ones working the phones to make calls to families each week, right? So their traditional role, or the role that they had, a year ago, now gets, revamped so that they are on the front lines of doing outreach to families to help create that cohesion. That's really made a difference. So all of that by seeing, the cultural and the linguistic, richness that exists, and not simply seeing one another as, as individuals, under masks, I think we want to continue to recognize one another's humanity, and to realize that's going to take longer than we probably think it will. Twitter's, and TikTok are filled with, students representing their experiences and teachers saying, I thought I was going to devote 15 minutes at the top of the, my first day back to saying, how are you? It didn't take 15 minutes, I'm building, that's going to be a theme throughout this week, and really that I thread throughout this school year, so really being patient and allowing for the time that it takes.
Great. Michael?
Thanks, Jim. I do want to circle back one moment for the last question you had asked me about the fiscal impact, because just some of the things that I mentioned about what Boston is spending on, I didn't even mention, that we're going to be spending several $1 millions to buy cameras for our classrooms so the teachers can be teaching remotely as well. And so these costs are staggering, what districts are going to be spending related to COVID. The $30 billion that was given to school districts in the CARES Act, quite frankly, was a drop in the bucket for last spring for Chromebooks, for hotspots, et cetera. And in the current HEROES Act in the House and the HEALS Act in the Senate, as Jim, you well know, you're helping lobby for this. They're looking at about $100 billion for school districts. Even that, combined with the CARES Act, will not equal what was done in the last Great Recession. And yet the costs are significantly more for districts now. And so there is we already have the twin pandemics of the health crisis and the systemic racism that has been exposed, that many of us work in the field knew was there and have been working on. But now, as Secretary Revel said on the Globe, when the tide goes out, this got exposed for everyone to see. But there's going to be an additional pandemic of a fiscal crisis as well from the economy right now, and districts are going to be struggling next year and the year after with the cost from this. So we need folks to lobby. Luckily, the New England delegation has been very solid on this, but we need help across the country on this issue for school districts and our colleges and universities to be supported as well. With regards to, advice or lessons learned, my wife says to me all the time, assume good intent. And I'm a lifelong Bostonian, which means I'm cynical and I'm suspect. And it can be hard for me sometimes to assume good intent, but I'm a good husband who listens to his wife. So that's my advice to people: of assume good intent. There are people working really, really hard on this. Our senior staff, the district probably hasn't taken a day off since March. And they're working really hard and they're doing best, and they're bringing in the experts from other fields to try to do the best for our students. And the other thing I would say is folks need to be flexible, and there are going to be new ways of learning that come out of this remote. Warren Buffett always says every crisis is an opportunity. I envision we're going to be looking at new ways of learning. If it's, it may be a student at Boston Arts Academy who wants to take a language class at Charlestown High School, or it may be, that can now do this remotely. We're going to be breaking down a lot of barriers because of lessons learned from this. I also envision there'll never be a snow day in Boston again. Students will simply work remotely. We will have snow in Boston, but students will work remotely for that day instead of having the day off. So there will be changes from in education. And lastly, I would say, To the folks who are working this day in and day out, I often paraphrase Teddy Roosevelt, where, these are not the critics or those who say how the doer deeds could do better. The people in our districts, from our teachers to our custodians, to our school nurses, to our senior staff, and yes, to our superintendent and school boards. These are the people who are in the arena. And we're getting the mud and the dust and the dirt on our face. We're trying, we're striving. Yes, we're going to err, but we're trying to do right. And I know I'm just simply paraphrasing Teddy Roosevelt when he talks about that. But I ask people to have patience and assume good intent and be flexible, and we'll get through this together.
Great. We have a couple of minutes left, 3 or 4 minutes. Does anyone like to add anything that hasn't been mentioned? Feel free to weigh in now. Sandy, Dr. Franks, Shelley?
I'll make one more quick comment so I still have the microphone open, if that's okay. And that is, I think we're also seeing, quite frankly, the value of associations right now. As we try to now network remotely, what the New England Council is doing, what the Council of Great City Schools is doing, what the Mass Association of School Committees are doing. And, Sandy mentions at the hospital side, the way associations have pivoted, what we can learn from our peers who are facing the exact same challenges, and the value of sharing and coming up with joint solutions is critical right now.
Jim, I just may make one comment. We've talked a lot about all the issues impacting schools and children broadly, with everything from their health to their mental behavioral health and everything. One of the things that I think we're all incredibly more aware of and focused on is equity. Equity, so that it truly, all of the good things that we're trying to do for children and for people broadly are truly balanced and available to everyone. Whether it is the issues that we're seeing in health, the inequities in health, and the disparities in health, whether we're seeing social, economically, I think that's something that, although we didn't spend a lot of time on, is something that every one of us on this panel, as well as so many of the things that you're doing, Jim, through the council and broadly, is something that has to be on our agenda as we look at not just the pandemic, but what the pandemic has exposed.
Exactly. Well said. Shelley, do you have any?
Yeah, I just absolutely agree. There was a comment or a question from one of the folks dialed in, why not prioritize K-5 in-person learning, for example? And that's one example of, we can make distinctions and prioritize some learners and some teachers.
Yeah.
And I think that's quite possible, and I'm seeing that happening in many different schools. And so perhaps the school is closed, but it is open to some young people who need a reliable access to the internet, or really thinking about public-private partnerships, getting a business in the community to donate the resources that are going to enable a Chromebook distribution, for example. Really thinking about how to extend resources to those young people who are most vulnerable and those families that might need some additional supports. And again, as I said before, and not to see that as a liability, but see, that everyone gains when there's full participation in the educational experience.
Great. Dr. Franks?
I think one thing I'd like to emphasize in closing is from the behavioral health perspective, that it's really important that we put our money where our mouth is in this regard. So at the policy level, it's wonderful to hear the things that, Michael spoke of that's going on in Boston, and really thinking about how we make behavioral health a priority. And I think this is something we've been working towards for some time, but that includes, how we fund behavioral health, mental health equity, making sure there's access for all people, irrespective of where they live and what their socioeconomic background is. Making sure that we have access to services that work, that are evidence-based, that have a research base. Families deserve high quality care. So I think one perhaps silver lining that has come out of this is that I think all of us can relate in a way that perhaps we never could about the impact on mental health, experiencing some stressors ourselves and seeing that in our loved ones and our families. And so I think it's really time for us as a society to change our paradigm a bit about how we think about the importance of mental health. and how we make sure that it's accessible for everyone.
Well said. Well, I just want to thank the panelists. Extraordinary conversation, very informative, and New England is blessed to have such outstanding, dedicated individuals that are really working hard day and night, as Michael alluded to. We're blessed to have all of you a part of the New England Council. I would only end by quoting a passage from Sandy's op-ed that she had published in the Boston Globe earlier this year. And it ends with this nice quote, I think. The more we study, the more we learn, and the more we share, the better we will understand COVID-19, and the better we can protect the health and the well-being, not only of our children, but of our entire population. That was very well said, and congratulations on that. But I just want to thank all of you again for participating. I know your schedules are very, very, very hectic, and you found time to be with us, the New England Council, today. I want to thank all of the New England Council members who also participated in questions and listening on the program today. So we hope that all of you stay safe. We say stay healthy, stay strong. We hope to see many of you in person sooner than later. But again, thank you for your time today and a great program.
Thank you, Jim.